Hello, my name's David Bottomley. I'm a consultant clinical oncologist in Leeds, and I have the pleasure to speak to Nick, who is a patient who has had radiotherapy to the prostate. Good morning, Nick. How are you this morning? And could you let us know a little bit about yourself?
Good morning. Yes, I'm Nick. I live in Malton, North Yorkshire. I'm 59, and I was diagnosed with prostate cancer in April 2022, and I commenced treatment in September 22 and finished my treatment in October 2022 at Leeds St James's Hospital.
Okay. And tell me a little bit about how you came to choosing radiotherapy as the option of treatment for yourself.
Well, the consultant did give me the option of surgery and radiotherapy, and I assessed it for quite a while, but then my consultant at Leeds seemed to think that the combination of hormone treatment and radiotherapy would be the most effective option. So that's sort of why I went down that route, but everything seemed to go according to plan. I was quite pleased with it, yes. So that's why I made that decision.
Did you do any background research yourself or speak to other patients at all?
Yes, well, I took advice from forums and various prostate charities but I also my brothers, there's a family history of prostate cancer in my family. So I took some advice from my brothers, because I have actually got 3 brothers in addition to me that's got prostate cancer. Okay. And 2 of them have had the surgery to remove the prostate, and my other brothers had radiotherapy, the same as me. So we've actually, in the family, there's 4 people with this disease, yes. So there's a family history of it, and so I was able to get a lot of advice from them, and they were actually quite reassuring about it.
Oh, excellent, excellent. Yeah. And did you have any anxieties about having radiotherapy or about hormone therapy?
Well, I suppose the surgery is more sort of clinical in terms of, you go in hospital and get it done with, and then the radiotherapy, I was looking at 20 sessions, but I didn't really. It was a bit daunting at first, but I think I accepted it. The consultant thought it was the best option to go for at that time. So I didn't really have any main anxieties about it. But as I say, I did a bit of research about it, and I went for that option sort of thing.
Okay, good. How did you prepare for the radiotherapy? Did you do anything in particular?
Well, they told me on the pre-plan when I went to Leeds that keep yourself well hydrated, drink plenty of water, maybe a high protein diet, maybe limit or avoid alcohol, and just keep yourself well, sleep well, get plenty of rest, and just keep a good sense of well-being. And the fitter you are, the better you are equipped to cope with it, sort of thing.
Yeah, that sounds like good advice. Yeah. And what happened when you went for that planning session? Can you run through what the procedure was?
Yeah, well, I think I was there about 2 hours, and this would be 2 weeks prior to the actual sessions. And basically, they do a scan, they scan you, and then they put these like little tattoos on your abdomen and to line up all the, procedure, the radiotherapy, and then they give you a bit of advice on, like they told me what to eat and, avoid alcohol, drink plenty of water, basically give you a sort of advice on what to do when you're going for your sessions. And also they give you quite a lot of enemas which you need before you start the procedures. Well, I'll go on to that later on. But it was you go through this pre-plan and you get these. I mean, these tattoos that they put on it, you can hardly see. I don't think I can find them now. Actually, you can hardly see them.
Good.
But
So quite discreet, yes.
yeah,
Yeah.
that's it. But
And
yeah, it's nice. Good, yeah.
and presumably the reason is for the tattoos was presumably to make sure that you were lined up
Yeah,
correctly
yeah.
each day.
I think it's to line up all the, all the measurements, and I mean, it's very clever how they do it, but it's basically to line when you're laid on this under this machine, it's to line everything up,
Yes,
to
so that
make
you're
sure
in the
everything. Yeah,
same position each day.
yeah,
Yeah.
yeah,
And going on to the enemas and the other preparations, these will have been done to make sure that your internal anatomy was as
yeah,
consistent, but with each treatment. What did tell me about the enema and any bladder
yeah.
filling you had to do?
Yeah, well, as I say, it isn't just a case of just turning up. There is certain things you've got to get right before you can start the procedure. But you would take 2 enemas, and I mean, I'm looking at my attendance sheet now, and on the first day, my attend time was 9:45. So I'd go in and do me enema. Then as soon as I got there, and I'd wait maybe 3/4 an hour for me drink time. That would be 10:30, and then because that was to fill my bladder up to a certain level, and then I'd have my treatment time at 11:15. So, but the enemas that I took, I'd take 2 a day just in case one didn't work or something like that, and but usually they did work. You've got to empty your bowel and fill your bladder up to protect your bladder from during the treatment.
Yeah.
So everything has got to come together before you can have that procedure.
Okay.
Yeah.
And when you were having the 20 treatments, did it all go fairly smoothly, or were there any issues along the way with the bladder or the bowel or anything like that?
They would often scan you, but they wouldn't scan you every day. I think they'll scan you every so often just to make sure everything's okay.
Yeah.
But the only time, there was only one in the early days I was going, there was only one time when me bowel was a little bit fuller than they said it should have been. But they said they did it, he said it wasn't a problem. But, that if you empty your bowel and then wait 3/4 an hour, then fill your bladder up, everything you'll find everything's right. I mean, I went one time, and the radiographer said to me, "Oh, this is brilliant. If you keep doing that, we'll get it done. We'll be spot on.
Okay.
Keep doing what you're doing," he said.
And when you actually were having the treatment, so you'd done the preparation with the enema and the drinking to get your bladder full, when you then were lying on the machine, what was that experience like?
Well, it's not. To be honest, it's not as bad as you think, because it's not. I found MRI scan a little bit claustrophobic, but a radiotherapy machine is sort of like panels that going round you sort of thing, and it's not alarming at all. It's I mean, often you're looking at a screen of nice landscape pictures, and maybe even there's music on or something, and it's just the procedure itself doesn't really take that long. I mean, I don't know how long it actually takes, but I think I timed it about maybe three or 4 cycles or something. But it doesn't. You basically just lay there, and it's not a problem at all. I found you get used to it, So it's
Okay.
and before you know it, the procedure's done. And as I say, it does take a bit longer if they scan you. They'll scan you before the treatment, for the actual radiotherapy treatment. But it's basically you just lay there, and I mean, you go in and you get put a gown on, and you lay on this thing, and they push you about and line everything up, and then they say, "We'll come back in a few minutes' time when it's all," and
It's
that's
all
it.
done.
Yeah,
And,
yeah.
And then the treatment, they've given you that treatment. How do you feel immediately afterwards?
Well, personally, I didn't really feel anything. I mean, they say you can feel tired, but I didn't really, maybe felt a little bit tired after the 20 sessions. But after the initial treatment, I mean, I just took one day at a time, just kept going to Leeds every day. And I mean, the times varied, but just, as I said, just take one day at a time. And I didn't feel anything untoward, you know, it just, you didn't really know you'd had it done, really, you know, it's nothing. I mean, I don't know whether it affects other men differently, but personally, it didn't really bother me much, you know. But maybe there is a bit of fatigue there in tiredness, but it's you can live with that sort of thing, you know. So,
and Malton's quite a long distance from Leeds. How did you get there and back each day?
Well, I was actually lucky because me family, I've got a very supportive family, and my brothers and my sister took me, you see. So, but I was going to use this patient transport, but I don't know, it never seemed to. I think I got a bit used to my brother taking me, but they were going to help me out with patient transport. But as it happens, things fell where my brother could take me. So, but it was a bit. I'm not the greatest of travellers, but once you get past York and you get to, you know, you can soon. I mean, it would be quite a few miles a day, but it was a bit challenging at first. But once I got halfway through, and then next thing I knew, I was on my last week sort of thing. So you see a light at the end of the tunnel.
Would you have felt up to driving yourself there and back if you'd had to?
Well, I think I could have done it. Yeah, I think. As I say, there is. You have to get these things right before you have the treatment. So there is that aspect. But I probably, you know, somebody probably could have driven every day. Yeah, I think they could have done it. Yeah, and then had the treatment. Yeah.
So apart from the tiredness you had after the radiotherapy course, were there other side effects that you had? Most notably, I suppose, in terms of you urinating and going to opening your bowels.
Well, they said that they did say that when I finished the treatment, they said they gave me a helpline a nurse helpline to ring in case of any problems with weeing and bowel problems and stuff. But I didn't really notice. It's hard to tell. I don't think I noticed anything significant. You know, like difficulty weeing or emptying my bowels and that. I think it was more maybe a slight tiredness. But you see, because I'm on hormone treatment as well, that could be making me tired as well. You see, so
yeah,
but personally, I didn't notice any major changes with weeing but I have heard that could maybe happen. You know, problem. Yeah.
I imagine your consultant told you before the treatment that you might get some urinary or bowel symptoms as the treatment went on. So, well done. You didn't seem to manage very well.
To bother me.
And later on, like now, do you have any side effects from the radiotherapy?
No, I mean, as I say, I completed in the autumn of 22, so we were coming into winter months. But after that, I just thought, well, I'd get plenty of rest, listen to my body, get plenty of rest, get plenty of sleep. I mean, I work from home anyway, so I can sort of like get, you know, recuperate a bit. But I actually found last year was a much more return to normality. You know, it's almost, I'm not saying I forgot about it, but I did things that I would, you know, kept active and just got back to doing normal things. And as I say, touch wood, I haven't noticed anything significant. But as I say, there is that tiredness. I think that's probably the main feature for me. Yes. You know, but as time goes on, I think your body sort of recovers, you know. So
and were you able to continue to work from home? What do you do, by the way, Nick? I forgot to ask
well,
earlier
I'm a
on.
media assistant for a
Okay.
local museum.
Oh, very
So
good. And you
yeah,
can work from home with that a lot of the time. Is that
yeah.
right?
Well, as I say, I was lucky, really. I mean, I mean, I did have to take a little bit of time off, you know, but
Yeah.
it's yeah, that's probably helped me a bit. I don't know, but as I say, I did. I've basically ever since I've had that radiotherapy, I've basically just thought, well, you know, listen to your body, keep active. I mean, you don't keep active, but you know, don't overdo it. If you feel a bit tired one day, even just to lay down or something after tea or something, just have a rest.
Okay.
And I found as the time's gone on since the radiotherapy, I felt I think more and more stronger, and my stamina's come back, sort of thing.
Okay.
So,
And you have you finished the hormone treatment now? Have
well,
you long since finished that?
the good news is that I'm due to, my consultant says he thinks I can come off it in April.
Oh, okay.
So
Okay.
I've been on it 2 years.
Okay.
So that's and my PSA is now 0.04. So
That's
that's
good.
looking good.
It's good. And are you exercise? I mean, like walking, going out, taking regular exercise and things like that
Yeah,
now?
well, I do go on for quite long walks because I find, you know, like bit of nature or walking countryside does you good. But
Indeed. Okay.
it's seems to be a big healer. But what another thing that I did find quite useful was when before I went into my radiotherapy, I aside from keeping a good diet and keeping hydrated, I did think, you know, did a little bit of relaxation techniques and even a bit of meditation, mindfulness, you know, sort of just to sort of reduce any anxiety levels, you know. But as I said, the fitter you keep the fitter you keep yourself, the more you'll be able to handle it, sort of thing.
Yeah, no, it sounds
Yeah,
like you've prepared very,
yeah,
very well for it.
yeah, yeah.
Let me just check if I've other things I want to ask you. Yeah. One of the questions is, if you went back to sort of 2021, 2022, would you have chosen this treatment again?
Well, I have asked myself that question a few times, but I think I would make the same decision. Yes, I think from I mean, obviously, my other two brothers have had surgery, but at the time, I felt this was the best option for me. And it looked, touch wood, it looks as if the combination of hormone treatment and radiotherapy has nipped it in bud, sort of thing, you know. So it's, I mean, I will have to be on PSA clinics for, I think, quite a few years. I don't know how long, maybe 5 years or something. But that's just you know, like 6 monthly PSAs and a phone call. So it's touch wood. From what the consultant told me last year, he thinks it's worked and it's looking good. So I think I would, if I was faced with the same decision now, knowing what I know, I think I would go down that route again. Yeah, yeah.
Okay. Thank you.
Yeah.
Is there anything else that you wanted to say that might help other men who are sort of at your position 2 years ago?
Well, as I say, you do have to make decisions, and there's a lot of tests involved. But I would say that if you personally, I thought everything went well, and even though it was a bit daunting traveling and all this, it is. I have to admit, it is quite daunting being faced with, you know, 20 sessions, like, but just take each day at a time and keep yourself well and do exactly what they tell you to do when you get there, and everything will be fine. And but as I say, luckily mine was caught early, all the signs are that the treatment's has worked and has been
Oh,
effective.
I'm delighted to hear that.
Yeah.
I'm delighted to hear that. Yeah, it's been a real pleasure speaking to you this morning, Nick. And of course, I wish you all the best for the years to come. And
thank you very much. Much appreciated. Yeah. Thanks.
You're
It's
very
great.
welcome.
Yeah.
Lovely to meet you.
Yeah. Thanks a lot. Cheers.